Assalamu alaikum.
I would be more grateful if I could. If the world is an image in my mind.
Remdesivir. What is Remdesivir? Remdesivir is an antiviral drug that was created to treat hepatitis C in 2009. But this did not work, and it was first used effectively in 2014 to treat the Ebola virus and other coronaviruses such as SARS and Middle East Respiratory Syndrome, that means MERS, MERS. Essentially, it gets into the RNA of such viruses and prevents them from making new copies of the virus. Remdesivir is an antiviral drug approved for use in adults and pediatric patients who are 12 years of age and older and weighing at least 40 kgs, about 88 pounds, for the treatment of COVID-19 requiring hospitalization. Remdesivir injection is used to treat coronavirus disease 2019 COVID-19 infections caused by the SARS-CoV-2 virus in hospitalized adults and children 12 years of age and older who weigh at least 88 pounds, that means 40 kg. Remdesivir is in a class of medications called antivirals. Next is, how should this medicine be used? How should this medicine be used? Remdesivir comes as a solution, liquid, and as a powder to be mixed with liquid and infused or injected slowly into a vein over 30 to 120 minutes by a doctor or nurse in a hospital. It's usually given once daily for 5 to 10 days. The length of your treatment depends on how well your body responds to the medication. Remdesivir injection may cause serious reactions, that means side effects, and after the infusion of the medication, a doctor or nurse will monitor you carefully while you are receiving the medication. Tell your doctor or nurse immediately if you experience any of the following symptoms during or after the infusion. Now I am going to discuss about side effects or adverse effects of Remdesivir. Chills or shivering, nausea, vomiting, sweating, dizziness, often standing up, rashes, wheezing or shortness of breath, wheezing or shortness of breath, abnormally fast or slow heartbeat, or swelling of the face, throat, tongue, lips, or eyes. Your doctor may need to slow down your infusion or stop your treatment if you experience these side effects. The most common side effects of Remdesivir are low blood pressure, nausea, vomiting, sweating, and shivering. More adverse effects are increases in levels of liver enzymes, low potassium, low RBC count, red blood cell count lower, gastrointestinal distress, respiratory failure. If you have been given the drug and face any of these symptoms, please contact your doctor immediately. Now I am going to discuss about interactions of Remdesivir. Remdesivir is at least partially metabolized by some enzymes. Blood plasma concentrations of Remdesivir are expected to decrease if it is administered together with rifampicin, carbamazepine, phenobarbital, phenytoin, or primidone. Using chloroquine or hydroxychloroquine with remdesivir may reduce the antiviral activity of remdesivir. Using chloroquine or hydroxychloroquine with remdesivir may reduce the antiviral activity of remdesivir. Co-administration of remdesivir and chloroquine phosphate or hydroxychloroquine sulfate is not recommended based on in vitro data demonstrating an antagonistic effect of chloroquine on the intracellular metabolic activation and antiviral activity of remdesivir.